Hello, everyone. Thank you for joining us for this month's webinar. Our topic is Women's Health Matters, and our presenter is Carla Fleming. She's a registered dietetic technician and a health coach with Strategic Health Services. Carla?
Thank you, Don. Again, my name is Carla Fleming, and I'm a health coach here at Strategic Health Services, and I am thrilled to share this information with you today from the topic Women's Health Matters. Women and men are different in many ways, and health issues are definitely one of them. When we say women's health matters, we are simply acknowledging that women have their own set of health issues, which deserve special attention and consideration. Now, one reason why women's health should not be an overlooked topic is women represent 51% of the population. Also, women do not only suffer from diseases specific to their gender, but they also are stricken with diseases previously thought to only affect men. And while women have many of the same diseases as men, their symptoms and treatments may not always be the same. So what are our objectives today that matters? We will first talk about some of the different health risks and issues men and women face, in addition to some that are common among them. We will also discuss lifestyle factors that could lead to improved health, and we will focus our attention briefly on important health screenings that should be completed on a regular basis as advised by your physician. Women's risk versus men's risk. Both men and women are predisposed to many diseases and conditions plaguing our country today. Here are some risk factors that are commonly known to be linked to gender. Let's start with men. Common risk factors for men are cardiovascular disease, which is the leading cause of death for men of all ethnic groups. Prostate cancer, skin cancer, lung cancer, and erectile dysfunctions are risks also associated with men's health. Now let's take a look at common health risks for women. Most are aware that breast cancer is one of the most feared today when it comes to cancer in women. But let's not forget, according to data, cardiovascular disease is the leading cause of death for both men and women. Uterine cancer is also a common and feared cancer among women today. The American Cancer Society estimates for cancer of the uterus in the United States for 2017 are about 61,000 new cases. Another common health risk for women is urinary tract infection, which typically occur when bacteria enter the urinary tract through the urethra and begins to multiply in the bladder, becoming an infection. Risk factors specific to women for UTIs include female anatomy, family history, poor hygiene, birth control, medications, suppressed immune system, and many other factors. Also, mental disorders can affect women and men differently. There are also certain types of depressions that are unique to women, which could result from hormonal changes such as perinatal depression, premenstrual dysphoric disorder, and perimenopause-related depression. But we will go into details about the risk factors and other related topics of mental illness within July's webinar, so please stay tuned. Here are more risks associated with women's health in addition to the ones previously mentioned. The other health issues we will briefly discuss more in detail are obesity, menopause, osteoporosis, and alopecia. It was previously mentioned that breast cancer, skin cancer, and uterine cancers are the top 3 common cancers for women. Lung cancer and colorectal cancer has also claimed many women's lives. Globally, lung cancer rates are decreasing among young women while rising for older women, and the risk of lung cancer death increased during the last 50 years for women smokers. Excluding skin cancers, colorectal cancer is the 3rd most common among females. Overall, the lifetime risk of developing cancer, a colorectal cancer, is about 1 in 23 for women. That is about 4.4%. Some of the risk factors associated with colon cancer include smoking, obesity, excessive alcohol consumption, lack of physical activity, having a family history of this cancer, and certain diets such as those high in saturated fats, processed meats, and diets low in fiber. What is breast cancer? Breast cancer is a group of diseases that affects breast tissue. Deaths from breast cancer have declined over time but remains the second leading cause of cancer death among women overall and the leading cause of cancer death among Hispanic women. Both women and men can get breast cancer, though it is much more common in women. Each year in the United States, about 220,000 cases of breast cancer are diagnosed in women and about 2,000 in men. About 40,000 women and 400 men in the U.S. die each year from breast cancer. Other than skin cancer, breast cancer is the most common cancer among women in the United States. So what are the signs? Some warning signs of breast cancer are new lump in the breast or underarm, thickening or swelling of part of the breast, irritation or dimpling of breast skin, redness or flaky skin in the nipple area of the breast, pulling in of the nipple or pain in the nipple area, nipple discharge other than breast milk including blood, any changes in the size or the shape of the breast, also pain in any area of the breast. Now, some women are at higher risk for breast cancer than others because of their personal or family medical history or because of certain changes in their genes. Studies have shown that your risk for breast cancer is due to a combination of factors. The main factors that influence your risk include being a woman and getting older. Most breast cancers are found in women who are 50 years old or older. Some other risks include early menstrual periods, late or no menstrual cycles, menopause, contraceptives. Some studies have revealed having dense breasts can increase a woman's risk. Also, obesity after menopause, not being physically active, smoking, and alcohol consumption. So one may ask, how can I reduce my risk? Some ways to possibly reduce one's risk are keeping a healthy weight. Another way would be limiting your intake of alcohol, getting plenty of rest, exercising regularly, avoiding exposure to chemicals that are known to cause cancer, and last but not least, having a mammogram yearly after the age of 40 or as recommended by your doctor. Skin cancer is the most common cancer in the United States. Melanoma, which is the deadliest kind of skin cancer, is caused by exposure to ultraviolet light, for short UV light. UV rays come from the sun or from indoor tanning, that is using a tanning bed, booth, or sun lamp to get a tan. When UV rays reach the skin's inner layer, the skin makes more melanin. Melanin is the pigment that colors the skin. It moves toward the outer layers of the skin and becomes visible as a tan. Please be aware that a tan is not indicative of good health. Actually, it is a response to injury because skin cells signal that they have been hurt by UV rays by producing more pigment. In the most recent study conducted, almost 72,000 people in the United States were diagnosed with melanomas of the skin, which includes over 29,000 women. So, what are some signs of skin cancer? Let's consider the ABCs. A, is it asymmetrical? Does the mole or spot have an irregular shape with two parts that look very different? B, is the border irregular or jagged? C, is the color uneven? D is for diameter. Is the mole or spot larger than the size of a pea? E is for evolving. Has the mole or spot changed during the past few weeks or months? Please talk to your doctor if you notice Any changes in your skin, such as a new growth, a sore that doesn't heal, a change in an old growth, or any of the ABCDEs of melanoma. Those who may have a higher risk are those who have a lighter natural skin color, a family history of skin cancer, a personal history of skin cancer, exposure to the sun through work and play, history of sunburns, especially early in life, a history of indoor tanning, a skin that burns, freckles, reddens easily, or becomes painful in the sun, and certain types and a large number of moles. So what are some ways women can reduce these risks or their risk? You want to stay in the shade, try to avoid the sun as much as possible, wear clothing that covers your arms and legs, wear a hat with a wide brim, wear sunglasses that wrap around and block both UVA and UVB rays, use sunscreen with sun protection factor of 15 or higher, and both UVA and UVB protection. Avoid indoor tanning. And remember, if you suspect anything unusual on your skin, please see your doctor. So let's dive into our next topic, uterine cancer. The most common type of uterine cancer is also called endometrial cancer because it forms in the lining of your uterus called the endometrium. Uterine cancer is the fourth most common cancer in women in the United States and the most common gynecologic cancer. Each year in this country, about 51,000 women develop uterine cancer and about 11,000 die from it. Symptoms and signs of uterine cancer include vaginal discharge that is not normal for you. It also includes abnormal vaginal bleeding, which may be considered abnormal because of how heavy it is or when it happens. It could also include bleeding after you've gone through menopause or bleeding between periods or any other bleeding that is longer or heavier than normal for you. Another common sign is pain or pressure in your pelvis. So keep in mind, there is no way to know for sure if you will get uterine cancer. Some women actually get it without even being at high risk. However, there are several factors that could increase the chances, though, of a woman developing uterine cancer, including if you are older than 50, if you are obese, that is having an abnormally high, unhealthy amount of body fat, if you take estrogen by itself without progesterone for hormone replacement during menopause, have had trouble getting pregnant, or have had fewer than 5 periods in a year before starting menopause. Also, if you take drugs to use to treat certain types of breast cancer, and or have close family members who have had uterine cancer. Some ways to reduce your risk could be using birth control pills, which could help balance out hormones, maintaining a healthy weight and being physically active, and taking progesterone if you are taking estrogen. Remember to ask your doctor about how often you should be checked for uterine cancer, especially if you have had or if you have a family history of this disease. As mentioned earlier, heart disease is the leading cause of death for women in the United States, killing 289,758 women in 2013. That's about 1 in every 4 female deaths. Although heart disease is sometimes thought of as a man's disease, around the same number of women and men die each year of heart disease in the United States. Despite increases in awareness over the past decade, only 54% of women recognize that heart disease is their number 1 killer. Again, a woman is 10 times more likely to die of heart disease than breast cancer. Heart disease kills more women than all cancers combined. It is the leading cause of death for African American and white women in the United States. Among Hispanic women, Heart disease and cancer cause roughly the same number of deaths each year. For American Indian or Alaska Native and Asian women, heart disease is second only to cancer. Almost two-thirds, that's 64% of women who die suddenly of coronary heart disease have no previous symptoms. Even if you have no symptoms, you may still be at risk for heart disease. And while some women have no symptoms, others experience dull, heavy to sharp chest pains or discomfort, including pain in the neck, jaw, throat, or pain in the upper abdomen or back. These may occur during rest, begin during physical activity, or may be triggered by mental stress. Sometimes heart disease may be silent and not diagnosed until women experience either heart attacks, heart failures, arrhythmia, and stroke. High blood pressure, high LDL cholesterol, and smoking are definitely key risk factors for heart disease. About half of Americans, that's 49%, have at least one of these three risk factors. Several other medical conditions and lifestyle choices can also put women at a higher risk for heart disease, including diabetes, excessive alcohol use, physical inactivity, overweight and obesity, being overweight and being obese, poor diet, and family history of heart disease. To reduce your chances of getting heart disease, it's important to make healthy food choices, such as watching your overall fat intake, limiting your consumption of saturated fats, and eliminating trans fats out of your diet. Another dietary tip is to avoid refined sugars and opt for whole grains, fruits, and veggies to increase your fiber intake. This could help decrease high cholesterol and triglyceride levels and stabilize blood sugar levels. Additionally, know your blood pressure. Having uncontrolled blood pressure can result in heart disease. High blood pressure is also known as the silent killer because it has no symptoms in most cases. So it's important to have your blood pressure checked regularly. Also, you want to minimize stress levels by finding healthy ways to cope with stress. Limiting alcohol intake can lower your risk. And also, having a healthy weight can reduce your chances of developing heart disease, which brings us to our next slide. What exactly is obesity? Is it just a term describing the way someone looks or feels? Weight that is higher than what is considered as a healthy weight for a given height is described as overweight or obese. Obesity is a body mass index of 30 or higher. The higher the BMI, the more indication of a higher body fat. Obesity is frequently subdivided into categories. Class 1 is a BMI of 30 to 34. Then you have Class 2, which is a BMI of 35 to 39. And Class 3 is a BMI of 40 or higher. And Class 3 obesity is sometimes categorized as extreme or severe obesity. Who is high at risk? Now, keep in mind that obesity is a complex health issue to address because obesity results from a combination of causes and contributing factors, including individual factors such as behavior and genetics. Behaviors can include dietary patterns, lack of exercise and activity, medication use, and other exposures. Additional contributing factors in our society include the food and physical activity environment, education and skills, food marketing and promotion. These are factors that can put one at risk for obesity. And obesity can put a person at a higher risk for other conditions such as high blood pressure, high LDL cholesterol, low HDL cholesterol, or high levels of triglycerides, type 2 diabetes, and cardiovascular disease. Remember, the key to achieving and maintaining a healthy weight isn't short-term dietary changes. It's about a lifestyle that includes healthy eating and regular physical activity. What is menopause? Menopause is the time in a woman's life when her period stops. It usually occurs naturally, most often after the age of 45. Menopause happens when the woman's ovaries stop producing the hormones estrogen and progesterone. A woman has reached menopause when she has not had a period for 1 year. Changes in symptoms can start several years earlier. So here are a list of symptoms common to women who have entered into menopause. They include a change in periods, shorter or longer, lighter or heavier, or with more or less time in between, hot flashes, night sweats, trouble sleeping, vaginal dryness, mood swings, trouble focusing, and less hair on the head and more hair on the face. Osteoporosis is a disease that thins and weakens the bones, where your bones become fragile and break easily, especially in the hip, spine, and wrist areas. Anyone can develop osteoporosis, but it is more common in older women. The percentage of women 50 years of age and over with osteoporosis of the femur, neck, or lumbar spine is 16%. It is a silent disease. You may not know you have it until you break a bone, or if you have a bone mineral density test done, which is the best way to check your bone health. Some symptoms include getting older, being small and thin, having a family history of it, taking certain medications, and being white or Asian or an Asian woman. To keep bones strong, you should consume a diet rich in calcium. You want to also get an adequate amount of vitamin D to help with calcium absorption. Incorporate weight-bearing exercise in your lifestyle and being tobacco-free. Now let's cover alopecia. Typically, a person loses up to 100 hairs from their scalp every day. That's normal. And in most people, those hairs grow back. When you are losing more hair than what is being replaced by new hair growth and you start to see bald spots and lots of thinning, then a person may be experiencing alopecia. The 3 types of alopecia are alopecia areata, also known as spot baldness. This is the type where there is an autoimmune disease in which hair is lost from some or all areas of the body, usually from the scalp, due to the body's failure to recognize its own body cells and subsequent destruction of its own tissue. This disease can cause complete hair loss in otherwise healthy people. There's also traction alopecia, which is caused primarily by pulling force being applied to the hair. This commonly results from the sufferer frequently wearing the hair in a particular type ponytail or pigtails or braids. And there's hereditary hair loss, also called female pattern alopecia. This is genetically inherited and can come from either the mother's or the father's side of the family. And it also could result from hormonal imbalances. There are many potential causes for thinning hair, but heredity is usually the main culprit. If you are experiencing any type of alopecia or excessive hair loss, please see your doctor or a dermatologist who can help to determine the source of the alopecia you're experiencing and offer the best treatment for you. Lifestyle factors that matter. Lifestyle factors are the modifiable habits and ways of life that can greatly influence overall health and well-being. So what are some lifestyle factors that matter? Make sure you are eating a healthy, balanced diet. You also want to stay hydrated by drinking plenty of water. Get an adequate amount of rest. Studies have revealed that women have a greater need for sleep than men, so get your beauty rest. Find ways to reduce stress. And lastly, get fit, be fit, and stay fit. Attempt to get at least 2.5 hours of physical activity in on a weekly basis. I think most of us will agree that exercise should be part of our lives on a consistent basis, but sometimes we may need the extra push to stay on track. So here are some great tips to get you moving and keep you going. Change into exercise clothes before leaving work. That way, you will be ready for your session and won't succumb to the temptation of skipping your workout. Put exercise on the calendar. Treat it like it is an important meeting or an appointment. You will more likely do it. Move while you watch TV. Don't sit idly during your show. Chair exercises, crunches, sofa push-ups, chair dips, and wall squats are some examples of movements you can do while watching your favorite show or during commercials. Maximize your time. What does this mean? Take a brisk walk when you go out for the meal, parking further away at work, or taking the stairs instead of the elevator are ways to maximize your time. Any opportunity you get to move more, take it. Wake up early by setting the alarm clock just 10 minutes earlier. Do stretches and jumping jacks or any exercise you enjoy to get your day started. Remember, taking small steps can lead to small successes, and small successes are the sum of big successes. Let's now focus on preventive screenings. For cervical cancer, it is recommended women aged 21 to 65 years are screened for cervical cancer every 3 years, and women aged 30 to 65 who want to lengthen the screening interval every 5 years. Screening for colorectals. Regular screenings for a colonoscopy should begin at the age of 50 and continue until the age of 75. Screenings for breast cancer. The American Cancer Society recommends mammograms should start at the age of 40 and continuing for as long as a woman is in good health. And lastly, regular physical exams are recommended every 5 years for ages 18 to 29, every 2 to 4 years for ages 30 to 49, and every 1 to 2 years for 50 years and older. Let's not forget National Women's Health Week, which begins on Mother's Day each year. It is a time for reflection on the importance of women's health, and the goal is to empower women to make their health a priority. So take a look at this list and decide how you will celebrate this week. What will you do? This concludes our webinar for today. Thank you for your time, and it is with great hopes that this webinar was informative and that it will motivate you to take control of your health, leading a healthier lifestyle. Remember, it is never too early nor too late to work toward becoming a healthier you. If you have any health-related questions or concerns and need support with any health goals, please do not hesitate to reach out to your health coach here at Strategic Health Services. Again, thank you and make your day a great one.